So
Okay, thank you. My name is Dr. AISHA UMAR. I'm the Director of Clinical Services. Before that, I've been that for 3 years. Before that, I worked as a Deputy CMA at the National Hospital in the same office for 2 years. Before that, I was the head of Department of Radiology, and I've been in National Hospital for the past 22 years.
okay, with you for that.
As a major achievement of the board and management of this hospital in the past 8 years?
Thank you very much. It's quite, it's not a very easy question to answer, but I would like to start by saying that continuing to maintain the services, the clinical services, which is the main reason why we are here, for the population of the FCT is one of our greatest achievements. Annually, the National Hospital receives more than 150,000 patients. In the past, when we did our 20th anniversary, we had seen equivalent of the population of Abuja. More than 2.4 million people had been to this hospital. We admit over 15,000 patients in a year. In a hospital that started with just 200 beds, that's a lot. We have a high turnover of patients. We have also expanded in the past 8 years from just basic services. We have obtained accreditation and trained an extra almost 70 specialists in 13 specialist areas in internal medicine, surgery, obstetrics and gynecology, radiology. Some of our trainees have won awards in the postgraduate medical colleges. In the past 8 years, we started a cancer center that is dedicated and has the ability to admit up to 50 patients. It has equipment to treat radiotherapy, patients that need radiation therapy. We do nuclear medicine diagnosis, which is one of only 2 centers, and we have to import the radiopharmaceuticals from outside this country. We have continued to do that. We also have succeeded in retaining some of the trainees in the Department of Oncology to expand our services. Recently, we have employed more consultants and residents to expand our services, and a department that started with only 2 consultants now has 9 consultants in oncology. In fact, the innovative way of maintaining service here is one in which, in rare specialties like oncology, the hospital has maintained and retained even retired consultants. We've not allowed them to go, so that the patients that are taken care of will benefit from the experience, that they have. In manpower development, besides training doctors, we have also successfully accredited the post-basic oncology school of nursing, post-basic nursing oncology program, and nephrology. The oncology is important because it is the only one in West Africa that trains nurses to take care of cancer patients. You know how it is for someone to be diagnosed with cancer. So if a family has a patient like that, they need the specialists, not just the doctors. The nurses have to give the chemotherapy. They have to be there with them every single moment, when they're giving them the blood transfusions, when they are monitoring them, when they're coming, in between visits to clinics. So we have been training nurses for some time, but we recently got accreditation, and we're the only one in West Africa. We train about 30 nurses every year. It's an annual program that is accredited. We were also saddled with the responsibility of starting the trauma center. The first national trauma center was inaugurated in 2014. All right. And in 2014, we started running this trauma center that is 80 beds in the hospital, and we received trauma, accidents, burns. Anybody that has an accident in Abuja, for the past, since we started the trauma center, they bring patients to us. So we now decided to start a postgraduate training program, the only one in West Africa, where we train people who have already graduated as consultants to specialize in managing trauma, because they need specialized care immediately they arrive so that they can survive. Just this morning, I had to go to the ward to see a patient you wake up in the morning, you don't know you're going to have an accident, but when you do have, you need to have care. And we are so kind that when the patients arrive, whether they have money or not, whether we know them or not, whether they're conscious or not, we provide the care they need until their relations arrive, because sometimes they're brought in by good Samaritans. And we have been able to treat more than 10,000 patients every year just in trauma center.
Wow.
Different kinds, yes. So these are some of the things. But then let me talk about COVID. I cannot talk about the benefits and the success of this management without mentioning the way we managed COVID-19. Because of COVID, we now have a new isolation intensive care unit, which is really important. So now we know that these patients need intensive care, and they can't be managed side by side with patients that do not have COVID. We also have a new molecular lab. Before COVID, we were not able to make diagnosis of some illness like Lassa fever or COVID or even Ebola, but now we have ability to do that by opening up a new molecular lab. The isolation center itself has been expanded to 7 beds from just 2. Before COVID, we had just 2 beds, and if a patient has an infectious disease like chicken pox and we don't want another patient to have it, we didn't have enough space, especially Lassa fever. But now we have ability, and this management has made those rooms like even private wing rooms. There are, 5 of them are single beds, 2 of them in share rooms, but they're really comfortable. The patients have their own bathroom, toilet, and they have dedicated staff that are there whether somebody's on admission or not. As I speak, we have 2 patients on admission, and we were able to manage over 300 COVID patients. What of obstetrics and gynecology? The National Hospital started as a hospital for women and children. We receive deliveries of over 1,000 babies every year in this hospital. And some of them are women who did not even do antenatal care here, but we don't mind. We take patients, even their babies that are premature. We have a neonatal intensive care unit that manages, very, very serious, we have a neonatal intensive care unit that manages babies that are hours old, some of them as low as 20 weeks, and they will survive. You recently heard about the Siamese twins that were separated by the National Hospital.
No, I was coming there. I was coming there because I want to look at by virtue of the excellence that we have in National Hospital and the level of professionalism.
Yes.
What are those breakthroughs, clinical breakthroughs, and medical science breakthroughs that the National Hospital over the years have been able to record?
Yeah, there are numerous. I have to go through departments, but most times it's through collaborative effort of multidisciplinary team. We are lucky to have manpower in over 43 subspecialties of medicine. 43 subspecialties of medicine. And when you have an institution with this degree of manpower, you can do things that people even think is not possible. For the first time in our history, 2 years ago, we were able to receive, keep, and successfully separate a set of Siamese twins with they were a team of about 79 staff that were involved in the management and surgery. But we thank them most sincerely for receiving these babies, keeping them for almost a year. They were here for before the surgery and then after. We still keep in touch with them. We have also collaborated with some Nigerians in diaspora to carry out surgery for pediatric open heart surgery. Yes, we've been doing open heart surgery. We've done special mission open heart surgery, and this has succeeded in helping patients whose parents cannot afford to take them abroad. And this was done at subsidized rate of 2.5 million at the time. But we're happy that we successfully, carried out 5 of such missions over a period. Yes, open heart surgeries were done. We also do very complex neurosurgical operations in clipping aneurysms. For those that know it, this is a big thing, and we have neurosurgeons who are able to also try to take care of spinal disorders as well. We have some areas of strength like oncology, trauma, orthopedics. We're really advanced in diagnostics, making the diagnosis for all the specialties. Burns and plastics, we have two very good plastic surgeons who help burns patients, some of whom people think cannot survive, because we have a specialized burns center that can take care of these patients. And we also have ENT. We do, cochlear implants. Cochlear implants is for patients who cannot hear, and then we use, a prosthetic device.
Yes.
And then we can fit this in, and then after some time the person starts hearing. So this is not something that, is easily done. It takes a lot of years of experience and training by the specialists for us to be able to provide this kind of service.
Okay, in spite of all these milestones that the national hospital has achieved over the years, what is the major challenge? What challenge do you think the hospital is facing to help the hospital to be more transformed and to do better?
The national hospital is at crossroads because we are a very highly specialized tertiary hospital in the center of the Federal Capital Territory that has other general hospitals surrounding it. So we receive patients not just from the FCT, they are referred to us from residents of FCT and those that do not live in FCT. There are also patients who, some of whom cannot afford the services, because the Nigerian healthcare system is one that is mainly fee for service. Only a few of them have health insurance. So when a patient is brought to you unconscious, you cannot send the patient away. You have to take this patient in and manage the patient first before you even know who is this patient. Sometimes we have to manage unknown patients. So in my 22 years of practice in this hospital, nobody has been able to pay for these patients. Just this morning, I had to give meal tickets to a nurse in ICU for feeding of an unknown patient that was brought to us. So when it comes to budgeting for the services that we provide, some of these things are not budgeted for, you understand? We also have patients who are indigent patients. If a patient is found on the streets in Abuja, they bring the patient to us. We have to provide medical care, feeding, sometimes even clothing. And when that is done, you don't even know where the patient will go to. Sometimes we liaise with social welfare So because we have expanded, our budget has not expanded to meet the needs. Do you understand? So sometimes we need to have maybe philanthropic support, extra budgetary considerations, and donations. This would help meet some of these needs, because we know that government alone cannot provide all the funds that we need to take care of the health of the people. And as a tertiary hospital, you have some equipment that will age and need replacement because of advances in technology. So this is the reason why to maintain the services at the level that it should be, because life is irreplaceable. You always have to use the best equipment that is available to maintain the service. You always have to provide for training of your staff to the highest level, so they stay on top of their game to ensure that they keep on delivering the service the way it should be. We need special considerations to ensure that this happens. The infrastructure in the hospital that is 22 years old also needs retouching, maintenance, replacement. We also need to have special considerations to ensure that this happens, special interventions, not just even in the face of dwindling resources. Consideration should be given to improving this, because everybody needs healthcare, whether you're well or not. Just today we're talking about starting a Saturday medical health program where busy people who cannot come during the week can come in to check whether they're well enough. If this happens, we feel that we will be able to promote the health of people while they are healthy and not wait to receive them only when they're sick.
Now,
okay.
See how we want.
No, one.
Let me just ship it for you. Now, a few days back, we had Dr. Hanre here to lay the foundation of the UMAR Center.
Yes.
I wonder, do we have other organizations with projects ongoing or in the pipeline like that, which is to help bolster the hospital?
Yeah, the National Hospital has collaborated with several organizations. You know, one of them is we call them Kids OR. Kids OR is a private Scottish non-governmental organization that is involved in maintaining operating theaters for kids. So they call it Kids OR. So they were able to come to our hospital and set up. Excuse me. So, because we have pediatric surgeons, theater,
Complete theater?
complete theater.
Wow.
Of other big hospitals, not only in Nigeria, in West Africa, how will you rate?
National Hospital, we're number one.
Good.
National Hospital is number one. We're not number one because I say so. We're number one because amongst the other hospitals, they have a lot of, some of them are older than us. We're one of the youngest hospitals. So we have had the opportunity of starting work with very young doctors who are technologically savvy, you know.
Yes.
They learn easily. And they use technology to do a lot of things. And they've also advanced with it. You know, we have a younger, 20 years ago, the average age of a consultant in this hospital was 30 years old.
Jeez.
Yes. I've been here 22 years.
No, you
understand?
I watch you now.
So that's it. I trained here. I trained in National Hospital. I stayed back here. And I've risen to the top and I'm still, do you understand? So that's the advantage we have. We had a very young population of young people who were being trained. National Hospital had the first MRI in the whole of West Africa. We have the greatest experience. Right now, we're examiners in the West African colleges, the national colleges. Our trainees are sought after wherever in many specialties because they have had the benefit of working with the most advanced technologies. You know, so that's one. Two, we've also expanded. Most hospitals started with a focus. We were supposed to be a two-specialty hospital, women and children. But when we decided to expand to these other specialties that we're training people in, we got state-of-the-art equipment because we had just acquired them. So that's why we have stayed on top. And then three, we were in the center, the Federal Capital Territory. We had the benefit of working in the presidency. The first 10 years of our establishment, we progressed a lot, all right? And we have migration of healthcare workers because of not being so happy. We're able to retain our staff. Some are leaving, no doubt, but they're coming back because this is a hospital where everybody is envy of Nigerians in diaspora. Everybody wants to collaborate with us. Everybody wants to collaborate with us because most of us have been trained abroad and back. We have the linkages, the networks, and we still chose to stay in Nigeria. You understand? So this is it. And then the output, our trainees, our work, our services, our research speaks for us. You understand? Just yesterday, one of my residents came to brief me on the outcome of his research, we just got him the fellowship, certificate. He modified a pump we have, we have a suction pump on the wall, but he was able to modify that to remove infections in wounds in children. Yes, in place of buying an equipment that was going to cost the patient $500, what he did would just cost $10-20. So we teach them to think how to modify and survive in this environment. So that's it. We're not going away. We still have a long way to go, and we also collaborate with our colleagues and learn from their experiences. So that's the advantage we have.
Okay, right. 22 years, National Hospital.
Yes.
Yes, you put in 22 years. How's it been?
How has it been?
Yes, as one of the foundations still here.
Yeah, it's been really nice to have contributed to the development. I want to thank the National Hospital for the investment in my education, and staying back was trying to give back. You understand? Because it's been a really great experience to watch a young institution that was seeing 5,000 patients a year grow to one that sees 150,000 patients. Anyone that I've seen patients who were born in this hospital coming back to this hospital now to do internship. They tell me I was born, my mother delivered me here, and things like that. So that's it. That's it. That's the joy of being in an institution like this for as long as we've been here. We have developed services. We have started. I tell people that where my office is located used to be a mango plantation. I was there the day they cut down the mango trees to build it, and then we use it, and that's it. So we have contributed, but we're grateful for the institution for giving us the opportunity to contribute to its development as well.
Thank you very much. On the final note, a gender-related question. How do you see the National Hospital vis-a-vis employing women? Because one of the issues we cannot keep away from the fact that some organizations, they say, women, bring in women. But then, having risen up to this level, how do you see the organization as being gender sensitive? And
I can tell you that now we have more female staff than male staff.
wow.
In the healthcare sector, yes, because majority of the staff are nurses and they're women. At the management level, the director of maintenance is female, as well as the director of clinical services. We are, I thank the management and board, and we have a board chairperson that is female. So we're gender sensitive, and we encourage women, and we want to encourage more women to take part in leadership because they're more careful than men, and they make less mistakes than men.
Thank you very much. Thank you very much.
Yeah. Thank you for your patience.
Thank you very much. Thank you very much. Thank you very much. Wow, this is very beautiful. Please, ma, is it possible those pictures? Because
Yes.
to be able to pick them out, sort them out from those people. Now that you can just see them, I don't know. Is it
Which
possible
people?